Our keynote speaker today is going to be talking about a subject that we've been discussing on and off in various ways through the last several years at the national conference when we talk about the individual needs to take control of his or her MG and to manage it and to live their life to the fullest. And our speaker today is going to be basically talking on a subject very similar because it's the power of positive thinking and the subconscious mind in myasthenia. And it's a great pleasure to introduce Dr. Khatri, who is, a former recipient, actually, of the MGFA Doctor of the Year Award back in 2004. He has opened the Center for Neurological Disorders in Milwaukee in 1990, and he is a pioneer in the field of therapeutic plasmapheresis, and his research contributions and participations in clinical trials to an effective plasmapheresis protocol therapy for myasthenia gravis. He is published over 65 papers. I'm not going to read everything that's in his bio. You can do that yourself and probably better. But he has a whole different side to him in addition to the medical side, and that is, and you can see his book out there, The Healing Soul, Unexpected Stories of Courage, Hope, and Power of the Mind. And this continues the sort of the series, if you will, where Lisa Gigliotti several years ago talked about courage and how she's dealing with MG. So these are powerful stories, they're powerful speakers, and they've got a powerful message. And hope you will take a lot home from what you hear. Dr. Khatri?
Thank you very much, Sam, and it's a privilege to be here, and I thank you all for giving me that opportunity. In the next 25 minutes or so, I'm going to focus on the power of the positive thinking and the subconscious mind in healing myasthenia gravis. And this is the book that I recently wrote, Healing the Soul. And what I'm going to do is I'm going to take a few examples from the book and make a point as to how you can heal myasthenia gravis or any other autoimmune disease or any other disease as well using the power of the subconscious mind. So I would like to share with you the story of my patient, Chris. Chris is a vibrant young lady who developed multiple sclerosis, which is an autoimmune disease that affects the brain and the spinal cord, whereas in myasthenia gravis, as you know, it's an autoimmune disease that affects the muscle receptors. Chris had the very severe form of multiple sclerosis. She was on the conventional treatments. She required frequent steroid therapy. But despite that, she was to the point where walking from one room to the other was a big chore. She would have to use a cane. And that's when we were invited to participate in a double-blind randomized control trial. It's an infusion that we would give once a month for 2 years. Some patients get the real drug, some patients get the placebo. We invited Chris to participate in the trial, and she agreed. And she started to receive the monthly infusions. 1 year into the trial, she was so much better that she trekked down the Grand Canyon with a 45-pound backpack. She was able to start running. She was able to run up to 7 miles. She started bicycling, 100 miles over the weekend. And then the terrible thing happened. The drug was pulled off the market because there were some deaths associated with the drug. And Chris was devastated. She did not know what to do because she knew this is the drug that gave her life, and now it is taken away from her. She pleaded with the pharmaceutical company. She's in the legal field. Said, I will not sue you, just give me the drug. And of course, the pharmaceutical company would not. She went to the newspaper. And in the morning, when I opened up the newspaper, she was right there in the front page with the big face. And it said, the drug that gave her life is now taken away from her. That afternoon, we break the code. And she was getting placebo all the time. She was not getting the real drug. So I called Chris and I said, Chris, I want you to know that you've been getting a placebo all the time. And there was a silence at the other end. And then she said, Dr. Khatri, that is the power of positive thinking. Never, ever did she doubt that she was not getting the real drug when she came for the infusion. Every time she came in, every month, she was fully convinced that she's getting the real drug. And this is so powerful, and this is what your subconscious mind, your power, the positive thinking can do. In fact, William James, who is regarded as the father of American psychology, once said that the power to move the world is in your subconscious mind. That's how powerful your mind is. And we'll talk a little bit about that in a second, but I would like you to share as to what happens. In case of Chris, she was able to conceive in her mind, and she consciously made the effort to say that I'm going to get the real drug, I'm going to get better. And that message was then passed on to the subconscious mind. And the subconscious mind then goes to town, does whatever it takes to make it happen. And we do know that when you think positive, when you think negative, all of that affects your immune system. There's a whole field of neuropsychoimmunology where we know that there have been a lot of studies done to show that when you think positive, your immune system gets better. It's able to fight the disease better. Whereas if you're under stress, when you have negative thoughts, it's just the opposite. So when your conscious mind tells the subconscious mind what to do or what sort of thoughts you are having, your subconscious mind reacts. And I'm going to share with you a very brief video of a patient. This is a patient who has multiple sclerosis, diagnosed for about 7 years. She's blind in both the eyes. She's very weak. She's confined to a wheelchair for about 3 years. She has a suprapubic catheter for the bladder incontinence. And she was referred to me because of severe spasms. I saw her for the first time. And there was something about the exam that didn't sit well with me. We did all the MRI scans and they were normal. So I say to her, you know, I've got some good news for you. I don't think that you have MS. What you have is an energy or a mental block. And we can undo that and make you better if you like. And she said, sure. So I said, do you mind if we do a video before and after? And you'll see this video as to what happens. Focus on my finger. I know. Can you see my finger at all? No. Okay, then she can't see that at all. Okay. Can you see the light at all or not?
Just vaguely.
Vaguely. Is it on or off? Off.
It's off.
It's off. Okay. All right. And she can't. And she gets the severe spasms. And that's going to get better. So what's going to happen? She's going to start seeing the light first, and she'll be able to read too. Can we see you walk a little bit? Okay.
I always fall to one side. One finger?
Okay. Great. That's beautiful. Brilliant.
Francis?
Yeah, right. Just read the first sentence and then we were supposed to be next.
3. Arkansas. WFHC. Something about a president.
Okay, go ahead, read it. Let's take a moment. Somebody start. And that's the second time you'll be able to do better than the last time. You can see that. Okay, now watch out, this says fire. Okay. Next time now. Good. Great. Let's go back.
Thank you, Dr. Khatri.
All right, let's go back.
So she was not faking. This was real. What had happened was that 7 years prior to this, she had developed some tingling numbness in her legs. She went to see her primary care, who said that you're young, you're Caucasian, you're in Milwaukee, most likely you have MS, and referred her to a neurologist, which she never went to see. She just assumed that she has MS. And her subconscious mind started to act. She went to the library, got all the books, and she developed all the problems that MS patients would have, and developed, she was blind for a year and a half. And within 15 minutes, she had become a prisoner of her own mind. So the question is, if Chris was able to convert a placebo into a powerful therapeutic agent, and here this lady who did not have the disease, but with her subconscious mind, was able to become blind, was able to get paralyzed in the legs, have bladder problems to the point where they had to do surgery. Then what if somebody has a terminal illness, has got a bad disease, and you convince them that they're getting better? Would that work? And as I was toying with that question, I was asked to see a very frail elderly man, 76 years old, who had double vision, had ptosis of the eyes, had breathing difficulty, swallowing difficulty, and within a very short time had to be put on a respirator because of the respiratory crisis. And when I saw him, it was very easy to diagnose that he has myasthenia gravis. We did a chest X-ray and a CT scan. It showed a big tumor of the thymus gland. And the surgeons went in and removed what they could, but it was a stage 4 cancer of the thymus gland. The standard therapy at that point was then to give him chemotherapy, but the oncologists were very concerned that he's very frail. The chemotherapy is probably going to kill him. But the family and the patient wanted something to be done, and he went on a chemotherapy. And he was the sickest person that you'll ever see in the ICU. His white cell count dropped to 0. He started to developing bleeding in the gut. He became septic. I mean, he's the sickest person you'll ever see. And they were thinking about putting him in hospice. But me and my assistant, my PA John, we would go to him twice a day and tell him, Bob, you're going to get better. Your x-rays look better. You're going to get out of this ICU. You're going to do well. Your blood count is looking great. And he's from Greece, and I said at one point, when you get better, you're going to go home, we'll have a party, we'll have ouzo together. But we continued this, and 2.5 months later, he walked out of the ICU. And he was going to come and see me in the clinic, and I was going to bring a bottle of ouzo for him, but I forgot. He came to the clinic, I examined him, and I said, Bob, you look great. And I got up and I said, I'll see you in about 3.5 months. So he got hold of my hand and he said, sit down, Dr. Khatri. And he pulled a brown bag, and there was a bottle of ouzo in there. And I called my assistant, we closed the door, and everybody had a little bit of ouzo. That's the first time we had liquor in the clinic. But so I asked Bob, and I did a video interview, which I'll show you in just a second. I asked Bob, and I said, Bob, do you remember us telling you that you're going to get better, you're going to get better? He says, yeah, you kept telling me. And I said, well, did you believe us? Was that helping you? He says, you were bullshitting me. And I said, okay. And then he said, but you know what, Dr. Khatri? But then God came to me and he whispered in my ears and he said, I am going to put strength in Dr. Khatri's hands. He is going to make you better. You're going to get better. He's your second God. You better believe him. And when he internally really came from within that he's going to get better, that's when he really turned the corner. It's amazing. So when I talk about the power of the positive thinking and the subconscious mind, it has to come from within. Just like how it did with Chris. That's how it happened with my other patient who developed all the problems. And with Bob. Because it came from within. He really firmly believed that he's going to get better. Let me show you briefly his video.
But the one of doctors, Dr. Hopkins, Dr. Rudy, the other doctor says, to get rid of it. There was John here, another one what happened says, Bob, you're going to be dead, you're dead, you're dead, you're dead, you're dead. Come on, John, one time I said, John, I'm not that, John, you don't know what you're talking about. I said to John. So next day he comes after the talking like what I said at that time. And next day John comes, says, I'm sorry, John. I tell you. Oh, it's okay, Bob. He says to me. So, but, I went through so many things. Yeah, I don't want to share it, but I don't want to share it to be too good if I can. So, but there's a doctor, special doctor, country, and the other doctors, yes, you told me that you will get better. Yeah, so yeah, I believe more than anybody else. I know they focusing on the body, I don't know for some reason maybe I can't push it up here. They say, you have to leave it not for time. That's what I did. I believe the other doctors too, but more for the EMD, more time.
And that's when, I don't believe that if we were not telling him that he's going to get better, he's going to get better, I don't think God would have paid him a visit. But I think that's when he really turned around. And I think the point I'm trying to make is that, when you invoke the power of the positive thinking, you really have to come from within. And it's going to help. And how do you achieve that? You meditate, you entertain some positive thoughts, you envision yourself as to what you want to be. Visionary guidance and in terms of the healing is very, very important as well. But this is Bob. He's 87 now. And he's driving, he's doing great. And every time he goes to the Greek store, he buys me a bottle of ouzo. And I've collected about 24 bottles, and I keep telling him, I said, Bob, I don't need ouzo. He said, no, you don't tell me what to do. So I said, okay. So I keep collecting this ouzo. So, the body has a tremendous power to heal. And as you know, there's 10 billion cells in the brain. And each cell has got enough information that would fit into about 1,000 books, 600 pages each. So you can imagine how powerful the brain is. So no matter how bad your myasthenia is, your body can heal. Bob could heal. Chris could heal. You can heal. And I'll share with you a very, very short story. This was a patient who overdosed, a young man overdosed on Tylenol and narcotics and alcohol. And by the time he came to the ER, he was comatose, he was on a respirator, and his liver functions were abnormally high. The surgeon wanted to do a liver transplant, which they did get liver, but just before the liver was flown in, he had a cardiac arrest. And he became almost brain dead with that. And they asked me to come and see him to see if it is really worthwhile to give him the liver. And I saw him, and clinically he was brain dead. We saw a little bit, very tiny response on the EEG with a high sensitivity. And I didn't know what to say. And I just sort of meditated for a while, and I finally said, something within me said, let's go ahead with the transplant. So I said to the surgeon, I said, let's go ahead. And the nurse right away said, Dr. Khatri, he's dead. The liver transplant costs a lot of money and everything, and there's some other people who may need it, more so than him. And I said, well, I don't know, but something tells me we should go ahead. So he got the liver transplant. That was on Thursday. and Friday, I left for Atlanta for a meeting. I came back on Monday, and the first thing I did was to walk over to the ICU to see. And in my heart, I knew that he would have been dead man. I don't think that I would find him there. But as I walked in, I threw the curtain out. He was sitting at the edge of the bed eating breakfast. And I had goosebumps. And I said, that is something else, because he was completely dead. And here he is, he's in the center with me, fully recovered. And he's a successful businessman now. But the point I'm trying to say is that the body has a tremendous power to heal. Don't despair. No matter how sick you are, you can make it happen. You can make things better. And lastly, one of the things that I want to share with you is that don't put things off. If you're focusing on something, do it now. And I learned this from my patient that I describe in my book. This is a couple, 86, 87 years old, married for 67 years. They came from North Carolina to Wisconsin to celebrate their grandson's graduation. And while at the graduation, he had a heart attack. And he successfully underwent a bypass surgery at a hospital, but then the second day he had a massive stroke that made him paralyzed, on a respirator, comatose. And after about 10 days, he was not making any progress, so I needed to talk to her and see how we should proceed. And so I went and she never left his bedside, never, just to go to the bathroom, and that was it. And when I entered the room, that's how I found her, just by her husband with her hand on her forehead. And I gently walked to the sofa, and she knew exactly what I was there for. We were going to talk about the end-of-life situation. And those were the most difficult steps she ever took. And we sat down, and we talked, and right away she said, Dr. Khatri, I want him alive. Doesn't matter if he can't talk or if he can't see me. He said, our 67 years of marriage went by so fast. I blinked my eyes, and they were gone. And I want to say so many things. I wanted to talk to him. I wanted to tell him something. And so I want him alive. And I said, okay. As soon as he's stable, we'll get an air ambulance to take him home. And then she looked at the clock and she said, Dr. Khatri, it's 7:30. It's late. Go home. Your family's waiting. And I said, okay. And I got up, and as I was walking towards the door, she called out and says, and Dr. Khatri, remember one thing. Tomorrow never comes. And it just hit me. It stopped me in my tracks. And for the first time, I realized the true meaning of tomorrow never comes. If you have to do something, do it now. My ride home from the hospital to my home completely changed the way I lead my life now. If I want to do something, if I want to hug somebody, if I want to love somebody, do it now. If you want to focus on your health, if you want to focus on exercise, whatever, do it now. It never comes back. And lastly, I want to touch on a little bit about the meditation and how that helps with the immune system, and especially with myasthenia, how that works. I travel quite a bit. Every year I go somewhere. And 2 years ago, I went to Thailand. And you can see my guide with the dark glasses in the front. And as we were going around, I would see a lot of monks with the bowl going around. And I turned to my guide and I said, So these are the monks who are making their morning rounds to beg for food. And she looked into my eyes, she touched my shoulder and says, Dr. Khatri, monks do not beg. They give you an opportunity to give. And it hit me. I said, oh, that's great. That's profound. And then I said, but how come I see so many monks in Thailand? They're all over. And she said, and I didn't know this, but in Thailand, every male at some point in their life become a monk for 6 months, 18 months, 2 years, and they come back into the mainstream. And she said that her husband, married for 17 years, had never become a monk. And he wanted now to become a monk for 2 years. And she gave him the permission. He went to the forest for 2 years. And all he did was nothing, no connection with anybody. This is her husband. She went to visit him only once, as a lay person would. No other connection at all. And he returned home after 2 years. And I said, was your husband changed in any way? Because all he did was meditation. In the morning, they would go and get their food, and that was it. And she said, yes, it was a profound change. With the meditation, it was a completely different man, much more quieted, would not raise his voice, his thinking, his clarity, everything had changed. And this is not surprising because there's a lot of work being done to connect the meditation with the immune function. And Dr. Richard Davidson at the University of Wisconsin in Madison has done quite a bit of work. There's a lot of other work being done to show that when you have a good frame of mind, when you meditate, when you have positive thinking, your immune system reacts accordingly as well. So lastly, I'm going to end by sharing with you my own personal story. As I said, I like to travel. And so one time I was flying in from Sweden, and on the flight I was thinking, where am I going to go next year? And I closed my eyes and I was thinking about all the places that I would go, and about 10 minutes later I opened my eyes, not having made up my mind, and in the front seat, in the back pocket, there was a folded newspaper. And right there it says, there was an ad. It says, come to Turkey. And I said, great, that's where I'm going to go. I'm going to go to Turkey. And I made up my mind, that's what it's going to be. But I didn't know how I was going to go. I was just thinking about it. A month later, I got a call from Thessaloniki, Greece. There's the biggest MS meeting was going to be. And they invited me to come and give a talk. And I looked at the map and I said, Turkey and Greece are neighbors. Go to Turkey, have fun, and then go to Thessaloniki. So that's what I did. So the day before my talk, there was no direct flight. So you can see on your right-hand side the arrow, that's Istanbul. And on the far-hand side is Thessaloniki. No direct flight, but a bus ride. That's a 12-hour bus ride. And I said, that's great. I'll start in the morning at 6 in the morning, get there at 6 in the evening, and you'll see the countryside. It will be fun. But 4 hours into the journey, we came to the border, and we stopped for our passport checking, and that's where the problem started. The bus would not start. And the drivers kept working on it. And some of these Greek drivers, they wanted to show us that they're really working. They took their shirt off. But it just would not work. And we all got worried. And the trucks and the buses and the cars that come by, they would not give ride to us. Finally, we got a word that a bus is coming from Thessaloniki they'll get us. But by the time the bus comes, it's 8 hours, and the 8 hours going back, I would have missed my talk. And now I really got worried. And I said, I go around talking about this power of positive thinking. Let me put it to use. So I closed my eyes, I meditated, firmly convinced that I'm going to get a ride. I really invoked the power from within me. And I envisioned myself giving a talk. And then I opened my eyes, a Mercedes-Benz rolled in at the checkout counter. And everybody rushed, and I could see the driver nodding his head, and he said, I knew they were not going to give a ride. But I was convinced that he was going to give me a ride. I went up to the driver, and I said, could you please give me a ride to the next town? Because I would like to rent a car. I need to be in Thessaloniki in the morning. He looked at me and he says, I'm going to Thessaloniki too. I said, great, give me a ride. I'll give you whatever you want. He said, no, I don't need the money. I said, I've got another companion and I've got 3 suitcases. That's fine, we don't have any luggage. So he gave us a ride, 8-hour bus, the car ride to our hotel at the doorstep. But that was not it. As we started to ride, he turned to me and he said, Dr. Khatri, why are you going to Thessaloniki? And I said, I'm giving a talk on MS. There's a big MS meeting. And I could see the tears in his eyes, and he said, I have been diagnosed with multiple sclerosis. And I said, wow, okay. And so we started talking more. And I said, who is your doctor? And his doctor was the one who had invited me to come to Thessaloniki. Now, is this coincidence, or is this something predestined? And he dropped me at the hotel, and I said, we need to take a photo together. Because when I tell the story back in America, nobody will believe me. And he is right in the center, Michael, and we took the photo together. And so, the power of positive thinking works. I firmly believe that. It does have an effect on your neurophysiology, your neurotransmitters, your neuroimmunology, all of that, and it helps you to heal. And the last story part of this is when I was writing my book, I wanted to put his photo and the story together. He had scribbled his name and his telephone number for me, which I had saved. And I called him up, fast forward 5 years later, and I couldn't reach him. The phone was disconnected, and I said, how am I going to get hold of him? I called their telephone company, the MS Society. I couldn't get hold of him. And then I vaguely remembered that there was a Greek doctor from Chicago who seemed to have some relatives at the time in Thessaloniki when he was there for the conference. So I wrote an email to him. I said, George, I need your help. If you have your relatives still in Thessaloniki, could you please have him find him for me? And within an hour, he wrote me an email. He says, Khatri, your luck would have it, I am in Thessaloniki myself. And he said he's going to find this person for me. By evening, I was talking to him that evening. So I think I'm just giving you all the small examples to make a point that the power of positive thinking, the power of the subconscious mind helps in no matter what you're dealing with, be it your health, be it your financial, whatever things that you want to focus on. Thank you very much.